Turkana County is one of the ASAL counties in Kenya. It is located in northwest region, and over the years we have had increased or significant numbers of maternal and infant mortalities. Accessibility to healthcare in Turkana County is quite hard for those that are located in remote areas due to the geographical area and also the nature of the people around here. Most of the people here are pastoralists, so sometimes with the changing patterns of living, you may find that mothers are not able to access antenatal health services or even skilled delivery. So we have been focusing on the community strategy. We have been capacity building our community health volunteers on matters of maternal child health, and they are able to sensitize pregnant mothers to access antenatal care at the health facilities. We also equip them with information on what to teach the mothers at household level. Due to this initiative, we've had a rise of antenatal care services. That is the first ANC. We've had a significant rise, that is of 60% significant rise. We promote skilled delivery at the hospital level as opposed to the traditional birth attendants, and this has improved significantly because of the mother baby kit that we provide to them at the hospital level when they deliver. And this kit helps them with some of the items they need for their babies and also for themselves.
Hiyo vitu yenye tunapewa hospitali ni vitu vingi kama beseni, shuka, sabuni, mafuta, nguo ya mtoto, nete ya mtoto. Imetusaidia kwa sababu wengi wetu ama sisi wote hapa hatuna pesa ya kununua vitu kama hizo. Sasa ukiona saa karibu kila mtu akwa na neti ya mtoto yake, na iliali wakati kitambo tulikuwa tunaona kwa mbali watoto wengine wakiwa ndani ya neti. Kwa wakati hii program ilikuja, utapata kila mtoto akiwa ndani ya neti, akwa na maleso, akwa na shuka yake, akwa na tawele yake, kila kitu. Kuna kitu yenye hakuna. Yani imetusaidia sana sana.
In terms of neonatal mortalities and infant mortality, we know that malaria is one of the killer diseases, and in this kit we are able to provide a mosquito net for the baby, so the baby is safe and we are able to prevent this infection from both the baby and the mother. When we look at the financial aspect of it, since there are several items in this kit, the mother is able to save that money and relocate it to some other things that she may need to buy at the household level. This could be food that she will be able to eat, especially during the postnatal period. So it's a beneficial project in all angles.
Napenda hiyo project itarudie kwetu, endelea na sisi, kwa sababu kuna wale hajiwezi. Vile hiyo project itaingia, kila mtu anajiweza. Wasaya kupata hiyo zawadi hiyo. Sisi shida yetu kutafuta tu chakula peke yake. Si kama siku ya mbeleni nilikuwa natafuta nguo ya mtoto, bado unatafuta chakula ya kukula. Tunatarajia hiyo project endelee na sisi.
We are looking into ways of how the county government of Turkana can continue to sustain this project. And negotiations are ongoing. We've engaged the county at different levels on how they can continue providing the mothers with some of these basic needs, like the mother baby kit, and also it's going to help the same increased accessibility of maternal child health services at the health facility.